A kidney stone is a hard mass of crystals that can form in the kidneys, ureters, bladder, or urethra. Urine contains compounds that consist of calcium, sodium, potassium, oxalate, uric acid, and phosphate. If the levels of these particles get too high, or if urine becomes too acidic or basic, the particles can clump together and crystallize. Unless the problem is addressed, the crystals will gradually grow over a few weeks, months, or even years, forming a detectable stone. A kidney stone can go undetected until it starts to move. When a stone travels through the kidney and into the ureter, its sharp edges scratch the walls of the urinary tract. Nerve endings embedded in this tissue transmit excruciating pain signals through the nervous system, and the scratches can send blood flowing into the urine. This can be accompanied by some burning sensation while urinating. If a stone gets big enough to actually block the flow of urine, it can create an infection or backflow and damage the kidneys themselves. Masses less than 5 millimeters in diameter will usually pass out of the body on their own. A doctor will often simply recommend drinking large amounts of water to help speed the process along. If the stone is slightly larger, medications like alpha blockers can help by relaxing the muscles in the ureter and making it easier for the stone to get through. Another medication called potassium citrate can help dissolve the stones by creating a less acidic urine. For medium-sized stones, up to about 10 millimeters, one option is pulverizing them with sound waves. The pulses create vibrations inside the stone itself, and small bubbles jostle it. These combined forces crush the stone into smaller pieces that can pass out of the body more easily. But zapping a stone with sound doesn't work as well if it's simply too big. So sometimes more invasive treatments are necessary. A rigid tube called a stent can be placed in the ureter to expand it. Optical fibers can deliver laser pulses to break up the stone. Stones can also be surgically removed through an incision in the patient's back or groin.